Okay, hello everyone. My name is Yara,
And my name is Hannah, and we did our project on alternative models.
and I'm going to be showing you guys our presentation right now. There we go. So as Hannah said, our presentation is on alternative models to address quality of care for children with ASD. I'm going to be first talking about the medical model. So the medical model is the ideas and ways that people observe, analyze, and handle problems related to human health and diseases in the medical practice. It is a historical category that reflects the characteristics, level, trends, and objectives of medical development at a certain historic age. So the medical model, according to Leifer, is not a scientific concept or theory. It's a metaphor which views psychiatry, psychiatrists, and psychiatric patients in the language of medicine. One approach that is scientifically based is applied behavioral analysis, ABA. Behavior analysis is a non-medical treatment for mental and behavioral disorders. Behavior analysis addresses socially significant behaviors, learned behavior, maintaining variables, effective treatments, and the generalization of behavior. ABA uses based treatments to help people improve their lives, and it's been around since the mid 1960s. Behavior analysts are responsible for all aspects of the behavior change program, from conceptualization to implementation and ultimately to discontinuation. So this image is by a blogger, and his name is Andrew Framer, and he believes this cartoon. I'm sorry, Andrew Frame, and he believes this cartoon demonstrates the status of employment under the medical model. So, as I've stated, the medical model of disability is built around the idea that disability is a result of physical or mental limitations of an individual, and it's not related to the physical and social environment in which we all live in. The medical model treats all individuals with disability in the same way. For example, all people with autism are categorically the same. Although their individual abilities vary from person to person, the medical model groups them all together. And as we all know, people on the spectrum are vary greatly in terms of ability and skill sets. And to ask a group of persons with autism to complete the same tasks in the same manner would be like asking the animals in this cartoon to perform the task of climbing a tree in the same manner. So not only is it unrealistic to think that it's possible, but it also doesn't allow individuals to use their specific abilities to complete the task. And then this image is attitude towards disability. So it just gives you an idea of the medical model versus, in this picture, the social model. So under the medical model, you cannot make decisions about your life, and under the social model, everyone is equal. Medical model, you are the problem, you are the sufferer. And then social model is society puts barriers in place, meaning they modify, the environment to get you to your full potential. Um, Medical model, you can never be equal to a disabled or non-disabled person. And then the social model believes that society prevents and restricts these opportunities. Oops, sorry. I didn't mean to get out of full screen there. So the medical model serves the interests of the pharmaceutical industry. This is another statement I wanted to share. The medical model proclaims that mental illnesses are brain diseases which can be treated with drugs the pharmaceutical industries make, market, and sell. So as a result, the pharmaceutical company promotes the medical model. So research on the benefits of the pharmaceutical shows Leifer has stated in 1990 in his critique of psychiatry that psychiatric theories are drug-driven, psychiatric therapies are drug-driven. The pharmaceutical industry grants millions of dollars to psychiatrists for research on psychiatric drugs from which the industry profits. Its advertising supports psychiatric journals, which publish the positive findings of this research. In another quote from Bruce Levin, he says, no biochemical, neurological, or genetic markers have been found for attention deficit disorder, oppositional defiant disorder, depression, schizophrenia, anxiety, compulsive alcohol and drug abuse, overeating, gambling, or any other so-called mental illness, disease, or disorder. And then to attack all these statements, the medical model of an illness process moves from recognizing symptoms to characterizing them as a specific disease in which the cause is known and treatment is rational and specific. Also, human medicine is continuously developing, and so is the medical model. According to, I'm sorry if I pronounce these wrong, Gong, Jiao, and Pan, the evolution process of the medical model, medical humanistic spirit is constantly developing as well. And they believe that in order to build modern medical humanistic spirit, the grasp of the evolution of the human model, as well as the development course of medical humanistic spirit, is highly necessary. And that is it for the medical model.
So I'm going to be talking about sensory integration therapy. So sensory integration therapy is designed to restore beneficial neurological processing by strengthening the neurological system. It helps children become more independent and participate in everyday activities with their peers. Sensory-based therapies involve activities that are thought to manage the sensory system by providing vestibular, proprioceptive, auditory and tactile inputs. Practitioners report 3 types of benefits of sensory integration therapy, one of which is an enhanced ability to focus on relevant materials in educational, therapeutic, and social environments. Another benefit is a reduction rate of maladaptive behaviors such as self-injurious behavior and aggression. And a third benefit is generalized improvements in the nervous system functioning, which is reflected in improvements in higher cognitive activities such as language and reading. So some pros of sensory integration therapy. There was a study done by Jane Roberts and colleagues with a 3-year, 5-month-old boy. The effects of the therapy resulted in the participant having reduced aggression, a decrease in self-injurious behavior, a decrease in the need for teacher direction, reduced mouthing of objects, and an increase in improved social interactions. The treatment procedure was run by altering 2 weeks of no treatment and then 5 weeks of treatment, and this went on for 11 weeks. Unfortunately, there was no discussion of how the treatment was implemented and what activities the participant participated in. Next slide, please.
This is the next slide, is it not?
That is, yes.
Okay.
Another study was conducted by Amel Carmen and his colleague, and this study included 34 children with autism who participated in a sensory integration program 3 times a week for 6 months. Therapy was provided in large gym settings with mats, swings, a ball pit, carpeted scooter boards, and other pieces of equipment. The activities were created so each of the senses could be used frequently during therapy sessions. The results of this study showed great improvement in the participants' motor skills after participating in this sensory integration therapy. The results of this program for fine motor skills showed significant improvement in the individuals that participated, which allowed them to participate in a variety of functional tasks as well as the development of adaptive behavior and an increased ability to learn. So some of the items that can be used during sensory integration therapy, which were mentioned in the study that I just talked about, were swings and exercise balls. And these are used during sensory integration therapy to stimulate the sensory receptors in the upper neck, inner ears, eyes, and the body. Some other items that can be used are scooter boards, and these are used to stimulate the, sorry if I mispronounced this, proprioceptive system, which processes information on the body's position and movement by receptors in the joints, tendons, ligaments, connective tissue, and muscle. And bubbles are also used for the tactile senses through the skin. So some of the cons of that were found of sensory integration therapy, which is the attacker, is that there is lack of solid evidence. Studies have indicated that sensory integration therapy is ineffective and that its assessments are not valid. Another study stated that some researchers argue that sensory integration therapy may cause an increase in behavior due to children having access to enjoyable items, attention from the therapist, and breaks from tasks that they may be assigned, which can be contingent on when problem behaviors occur. So a response to parents who would want to try these alternative methods is that parents have the right to choose their choice of treatment. However, we would recommend ABA and sensory integration as they are proven to be effective based on scientific evidence. Extensive work in ABA dates back to the mid-1900s. ABA is a data-driven field with behavior analysts who maintain the high standards of behavior in the profession.
These are our references. We hope that you enjoyed our presentation. Let me just get back here. Hello, so we hope you enjoyed our presentation and got a better idea about the medical model and sensory integration therapy, as well as applied behavior analysis. Thank you.